Chapter 1. Understanding Generalized Anxiety Disorder. Have you ever found yourself overwhelmed by constant worry and fear, even when there's no direct cause? If so, you may be experiencing symptoms of Generalized Anxiety Disorder, often abbreviated as GAD. Generalized Anxiety Disorder is a common mental health condition that can cause significant distress and impairment. This disorder is characterized by excessive ongoing worry and tension that is unfounded, or much more severe than the normal anxiety most people experience. People with GAD often find themselves excessively worrying about everyday life events with no obvious reasons for worry. They may always anticipate disaster and can't stop worrying about health, money, family, work, or school. The worry is often unrealistic or out of proportion for the situation. Chapter 2. Symptoms of Generalized Anxiety Disorder. However, worry is not the only symptom of Generalized Anxiety Disorder. There's a whole array of physical and psychological symptoms that can manifest. These can range from feeling restless or wound up to being easily fatigued, irritable, or having difficulty concentrating. Some people even report their mind going blank because of the constant worry. Physical symptoms can be just as distressing. These may include muscle tension, sleep disturbances such as insomnia, and experiencing gastrointestinal problems. It's important to note that these symptoms must be present for more days than not, for at least 6 months for a diagnosis of GAD to be considered. Chapter 3. Impact of Generalized Anxiety Disorder. The constant worry and fear can make it hard to carry out daily activities and responsibilities, can interfere with relationships, and can cause physical health problems. It's more than just the occasional worry or fear. For a person with GAD, the anxiety is chronic, and they often struggle to remember the last time they felt relaxed or at ease. In summary, Generalized Anxiety Disorder is a chronic condition characterized by excessive, ongoing worry and tension. This worry often centers around everyday life events, even when there's no obvious reason for concern. The symptoms of GAD can be both physical and psychological, ranging from restlessness and irritability to sleep disturbances and gastrointestinal problems. These symptoms must persist for more days than not, for at least 6 months, for a diagnosis to be considered. Chapter 4. Seeking help for Generalized Anxiety Disorder. Living with Generalized Anxiety Disorder can be a long-term challenge. It's more than just feeling anxious and stressed out for a few days. It's feeling worried, anxious, and tense about just about everything, even when there's no need to worry. Remember, if you or someone you know is experiencing these symptoms, it's crucial to seek help from a mental health professional. There are treatments available that can help manage and reduce the symptoms, improving quality of life. You don't have to navigate this alone. There are plenty of resources and professionals ready to help.